Hello, my lovely friends. Hello, my lovely friends. Thanks for coming again to my channel. This is Tetsi, and I come to you from lovely sunny London to show you the latest techniques and methodology for applying leeches for various conditions. Today's topic is how to treat knee pain as well as lower back pain. So I have here Jelio, who's got some knee pain, and I'm going to apply leeches on the acupuncture points of the knee for that purpose. And I will need my trusty jar of leeches, my gloves of course, my mask, and a whole bunch of other supplies such as masking tape, lemon to take off the leeches. I need some padding, and of course you can buy everything from leeches.com, including your medical leeches. So let's get started, shall we? And the first thing I will do is fill up my cupping tool with the leeches, and here I have some very lively boys. Those are certified clinical leeches that have been ordered online from leeches.com, and they're extremely robust and strong and very, very healthy. So we're going to be using those for Jelio today. And what I do is I'm going to place a few, actually not in this tool, but these are my leech forceps, by the way. I am going to put them in another tool. This one, this is called a leech tube. And I can put up to probably 20 small leeches, or maybe even 30. So the points where we're targeting are on both sides of the kneecap. So right here would be one point, and of course, because the patient has a hairy sort of knee, it's going to be a bit difficult for the leech to latch, but hopefully we can trick it into biting. And I'm going to ask you to hold this leech tube at this time while I go and grab my leech pricking device. So I'm going to be using these lancet needles for leech therapy. And I'm going to prick Jelio to let out some blood so that he can get his leeches to latch. So right there and right there is where the points are. And all we need to do is just prick and let the blood out. We were not able to successfully let any blood out with that prick. So I'm going to do it again. Thanks, Julio, for letting the leech drop to the floor. Now that we've managed to get some blood to flow out, we're hoping that the leech will bite, although being that he's so hairy, we might not have any luck with that. Now, to increase our chances, I can stuff up a little jar full of leeches and put them on the same spot. And at that time, usually I get at least one to bite, if not many more. And I simply cup in place. And by the way, if you guys haven't subscribed to my channel already, be sure to do so. The red button is below. Subscription is free, and it just simply allows you to follow me on YouTube so that you don't lose this channel and you get to learn a lot. So be sure to press it. And we've already got one guy that's really interested. Hopefully you can see him. He looks like he's about ready to bite, and there's also another guy next to him trying and wanting to do the same. Yes, we've got one biting.
Yes, it bites.
So we can now move on to the next point, which is right here. Okay, we got the second one. No, the second one's not biting yet. So we're going to apply guy number 2 using the same method. And just for information purposes, blood-sucking leeches, because I've gotten so many questions from you guys asking how long do leeches live, what are they being fed on, etc., etc. So I'm going to inform you of a few facts about leeches. These leeches come from leeches.com. It's a distributor, worldwide distributor of leeches. Medical leeches for clinical purposes, for Girudotherapy, for leech therapy. These leeches have not been fed at least for 6 months, and they are very hungry. Have we got one biting? We've got a couple interested.
Yeah, I can feel it.
You can feel what? There's nothing biting you, so I don't know what you're feeling.
One bite me.
One is biting you. I don't see it.
Yeah.
Yeah, what?
This one bite me. Oh, the two of them bite me.
Bit me.
Bit me.
Okay. So he's reporting that he's even had two that bit. So let's move on to the next point. These are the next points, and we will do a gentle few pricks. Julio, looks like you've fallen on your knee here.
Yeah.
When did you fall?
Last night.
Okay. And that's why you have the knee pain.
Mm-hmm.
Yeah, so to continue with my overview, leeches have been known to... People have been asking me how long do leeches live, as well as what are they being fed with. So as I mentioned, leeches.com distributes leeches all over the world, and they're not being fed with anything. So 6 months they've been starved, at least, maybe even more. And the distributor doesn't feed the leeches, but the distributor does receive them from suppliers who are usually leech farms, and they do the feeding. And they are experienced with that kind of thing, with leech breeding and feeding. Okay, so we've got another guy biting. So as you can see on both sides of the kneecap, we've got leeches biting Julio. And this right there is his wound from the fall, where he has injured his knee and is now hurting him. So when you get your leeches, they'll be at least six months hungry. And when you start to apply them on yourself, they should bite immediately, just like these leeches. A fed leech would never bite. So no matter what you do, you can't entice a fed leech to bite. Normally, fed leeches are disposed of.
Oh, I can feel the hirudin.
Okay. Normally, fed leeches are disposed as medical instruments, and they're being killed, and they're being put in the biodisposable bin. I don't treat leeches as medical instruments. I treat them as humanely as I possibly can, and I do not kill them. I have a few friends who collect fed leeches. So I will personally either send my fed leeches to them, or I'll release them in a public body of water, or I will have the patient take care of the leeches themselves. Julio is experiencing a lot of biting.
Yeah, he have big tooth.
They have big teeth.
Big teeth.
Well, guess what? In a few minutes, you're not gonna feel anything.
I know.
So, as I was saying, leeches are hungry when you receive them. They will bite you. You might need to prick yourself. As you can see, I've had to do that just now. And they will suck. Once they suck from you, they will not be able to suck for another 3 to 6 months. So if you're looking to reuse the leeches, you will be able to, however, you have to wait for them 3 to 6 months. There is a method in which you can get your leeches to throw up and reuse them again, but I've never ever successfully been able to do that because my heart doesn't let me, it just doesn't allow me to torture animals, and I haven't been successful in torturing them enough so that they would throw up. Usually people would use cumin or curcuma, whatever they use, you know, the yellow curcuma, cumin powder. Julio, I'm going to need you to stand up and turn around so we can put the leeches on your back of your knee. So just get up and turn around, please. And can you lift up this sleeve? Thank you very much. And I'm going to...
I think there's no need to prick me because they don't...
Okay, Julio doesn't want to be pricked. He's clearly stated this. This right here is the point of lower back pain. And he has requested that I don't prick him. He doesn't particularly like it. He doesn't enjoy being pricked. Sometimes the patient doesn't have any choice because if I can't get the leech to bite, we would then have to prick whether they like it or not. Have they bitten you? We've got one. All right. You're lucky.
Oh, yeah.
You are a lucky boy today, Julio. So, as you can see, we've got a big leech to bite, about 2 fingers distance from the bend of the knee. This is the position, this is the exact position actually where the point is to treat lower back pain. And if you watch traditional Chinese medicine bloodletting techniques, you will see lower back pain bloodletting is done right here on this point. And what they do is the doctor will press this area like this, and it will cause for the blood vessels to expand. When they expand, he'll take a needle and he will stab it as vigorously as he possibly can, and then he will squeeze out the blood so that it will come out with a force, so it will shoot out very vigorously. That constitutes for release of pressure, and the patient immediately, like this, experiences relief in their back pain. And how are you feeling right now? Are you feeling okay?
I feel fine.
Yeah, is this bite too strong?
No, I don't feel it.
You don't feel it? Okay, what you could do is you could turn around and sit down again, but just make sure that this back leech is not being pressed against the chair. I will open the window and I'll be right back. So while the leeches are engorging themselves on Željo's blood, I'm going to give you a few more facts about leeches. They live about, I would say about 3 years, could be more. If you find a 3 or a 4-year-old leech, it will be really humongous. In fact, let me see if I can find one to show you. There's one really big one here. And this one is I would say this might be a 2-3-year-old leech. A 4-year-old leech would be even bigger, and I have seen much bigger than this, but this is one of the bigger ones. By the way, if you have any questions, don't forget to let me know in the comments below. You can also book a private Girudotherapy consultation appointment with myself, and I do have a page on leeches.com where you can book that appointment. I also perform Girudotherapy sessions in the London area. If you're ever here and you want to get some leeches on you and make you feel good, then look me up and you're welcome to come and get some therapy. But meanwhile, our leeches are getting full. And the whole time I'm actually, oh, this one fell off so quickly. And it's not because I was touching it, it's because it's very, very full. So here I'm separating it into a totally separate vessel because you don't want to mix your fed leeches, your hungry leeches with the fed. They will cannibalize each other, they will bite each other, and they might even kill each other. So Željo now has some blood dripping down. So, and he's not very prepared today, so I've had to fetch some paper towels. While you have all the other leeches still sucking, you may not be able to bandage the wound. So all you can do is just sort of dab it like this. And the reason I don't wipe like so, I don't do this, I only dab. And you might ask why? Well, the reason is because when you wipe like this, you're actually disturbing the actual opening. So the opening is sort of like a Mercedes form, and it's got 3 flops. So the leech has cut in a Mercedes fashion his skin, and there are 3 flaps like this. When you wipe, you're actually disturbing those flaps, and it does hurt the patient. And when you dab like this, he doesn't feel anything. The leech has injected its 360 components inside his skin, inside his blood circulation, in his capillaries, and he's actually not feeling any pain at all in this wound, in this area. Except if I wipe it like this, then he will feel a bit of a just uncomfortable sensation. And as I've mentioned in my previous videos, the newest and latest practices in Russia by Girudotherapists involve the application of 50 to 60 leeches all in one go, in one session, in one sitting, maybe even in one location. So for all of you out there who think, oh, I'm going to solve all my problems with 4 leeches, 5 leeches, 10 leeches, well, not exactly. Because for serious bloodletting to occur, you actually need more than 10 leeches, a good number of leeches. But on your first time, then you want to do 10, because your blood is not trained and it's not used to having so many leeches dilute your blood and inject hirudin, which is superior to heparin in thinning the blood. And so all of these romantic thoughts of applying 4 leeches on any one area and solving your problem may not actually work. But if you purchase a large number of leeches and start systematically applying them and achieving very good blood flow and bloodletting effects, then you will have, over time, you will feel a tremendous improvement. There are certain conditions in which you can apply 3 or 4 leeches and have the condition disappear and be cured and be resolved. And those conditions include any kind of lumps, bumps, cysts, or cancerous formations that are in their initial stages, and as well as hematoma in pets, house pets like dogs, cats, horses, sheep, any kind of animal with hematoma will probably, and can be even cured with 1 leech. I've heard of cases where just 1 leech was enough for a cat or a dog. But in most cases, you're looking at 10 leeches or more for larger animals such as horses. You're looking at 10 leeches or more for humans. You are looking at 20, 30, 40, 50, up to 60 leeches for serious, chronic, old cases and conditions. And here we have another leech that I just released. And we'll be putting that little guy along with our other. I think one more let go, didn't it? Just now? Okay, so we have another one. They're letting go really quick today with Gelio. He's got nice blood flow. He's got nice, very good trained blood, so none of the leeches are really falling asleep or taking too long. And what I'm going to do with these guys, the fed ones, is that I have a friend who actually wants to breed leeches. So he's requested if he can keep all of my fed leeches, and instead of putting them in the water, he's asked me to just pass them on to him. He's got a pond in his back